Pregnancy testing is one method of monitoring reproductive efficiency and detecting any problems early in the breeding cycle. The key to profitability for all beef breeding enterprises is high reproductive efficiency. This means achieving 95 calves weaned to cows joined, an average calving interval of 12 months, and a calving spread of 10 weeks or less. A wide variety of methods have been used, and each has its own advantages and disadvantages. When assessing which method to use it is important to remember that it is actually the early identification of non-pregnant cattle that is important, as it is treating these non-pregnant cattle differently that provides the economic benefit of pregnancy testing. Early pregnancy diagnosis is crucial to shortening the calving interval through enabling the farmer to identify open animals so as to treat and/or rebreed them at the earliest opportunity. The objectives for pregnancy diagnosis is an essential part of fertility management. Besides, early identification of non-pregnant dairy cows and heifers post-breeding can improve reproductive efficiency and pregnancy rate by decreasing the interval between AI services and increasing AA service rate. This pregnancy diagnosis used to early detection of pregnancy allows early recognition and treatment of problems. Also is essential for reproductive management as well as economic production. Next, to detect animals that have been inseminated returning to heat is the most cost-effective method of early detection of non-pregnancy. Pregnancy diagnosis is a reliable technique for early detection of pregnancy, would allow early detection of pregnancy, would allow early culling or rebreeding of barren or non-pregnant females. There are many types of pregnancy diagnosis. For example, our clinical diagnosis. Direct method for early pregnancy diagnosis involve direct detection of the tissue or associated fluids of the conceptus either manually or via electronic instrumentation. There are several methods of direct method that are available for diagnosis of pregnancy. Next is visual diagnosis. The non-return to estrus, estrus hemorrhage, exposure to a bull, and artificial insemination are all diagnoses that can be made using the visual method of pregnancy evaluation. Lastly, laboratory method is early detection of pregnancy with a high degree of accuracy early after mating is vital for appropriate reproductive management programs to facilitate the rapid re-insemination of non-pregnant females and reduce the calving interval. For the visual diagnosis, firstly is the non-return to the estrus. Following insemination, estrus detection can be used to identify non-pregnant cows and enable the resynchronization of such a group of cows. An animal becomes pregnant after mating if it does not go into estrus again. This occurs because the conceptus stops the corpus luteum from regressing during pregnancy, which prevents the animal from entering estrus again. Other visible signs of pregnancy, besides the non-return to estrus, include an increase in the size of the abdomen, development of the udder or mammary glands, particularly in dairy heifers from 4 months onward, a slight vaginal discharge in dairy cows from 4 or 5 months onward, and movements up the thoatus visible externally, especially in fed cows on the right side of the abdomen months onward. These visual diagnostic symptoms are usually inaccurate, thus clinicians must utilize them in addition to clinical diagnosis. Next, visual diagnosis is exposure to a bull or artificial insemination records. Some methods for indicating that a cow is pregnant include a history of cohabitation with a bull, the observation of mating or artificial insemination. Even though the incidence of fertilization is high, only around 50 of inseminations lead to a detectable pregnancy. In contrast, unexpected, unnoticed, or unrecorded mating occurs frequently. Therefore, history may occasionally be misleading and is not a reliable determinant of pregnancy status. Lastly, the visual diagnosis is metastrous hemorrhage. cows frequently experience a bloody vaginal discharge 24 to 48 hours following estrus, which is brought on by hemorrhage from capillaries in the uterine lining as a result of the rapid oestrogen decrease that occurs after ovulation. It is assumed that estrus was undetected and the animal is not pregnant, as well as their placement in the uterus. If metestrous bleeding is discovered in a cow who was not spotted in estrus a few days earlier, they can be palpated there to determine the stage of gestation, since they are most consistently sized directly in front of the cervix. For the clinical diagnosis, firstly is transrectal ultrasonography, sophisticated imaging technology that utilizes high-frequency sound waves, has made diagnosis possible as early as day 28 after insemination or even earlier. Also reduced the interval from insemination to pregnancy diagnosis by 7 to 9 days. An accuracy over 99 can be achieved, enabling fertility problems to be identified rapidly. Pregnancy can be detected earlier with ultrasound compared to rectal palpation. Besides that, transrectal palpation also the clinical diagnosis, a very time-honored technique for the diagnosis of pregnancy, also allows an estimation of the stage of pregnancy. The pregnancy status was diagnosed, and days in gestation of each cow were determined by peer rectal palpation 70 days after a 100 accurate at determining the pregnancy status 35 days post-breeding. The easiest, fastest, cheapest, and most accurate method. Last types of pregnancy diagnosis is lab method. Firstly are blood or milk testing for progesterone levels or pregnancy-associated glycoproteins, PAG. This method detects a set of proteins that are produced by the placenta when a cow becomes pregnant. The proteins are first detectable at 24 days of pregnancy, but only reach diagnostic usefulness at about 28-30 days post. IA secondly, using the barium chloride test or Elisa to detect progesterone for lab method in pregnancy diagnosis. The barium chloride test can be an inexpensive and time-saving alternative to Elisa in pregnancy diagnosis when the insemination date is known. The advantages used laboratory method is sound excellent, with 99 sensitivity, the ability to detect a pregnant cow, and 95 specificity, the ability to detect an empty cow, while for disadvantages of laboratory method are the test is conducted 21 to 24 days after insemination. Even if the cow is not pregnant, it will be in the diestrus phase with the corpus luteum actively producing progesterone, which can give a false positive result. Next, it requires manual dexterity in handling the equipment. Also, embryonic death after 24 days can mislead. In conclusion, we can determine that pregnancy diagnosis is an essential part of fertility management. It will allow for early detection of pregnancy that help in the early recognition and treatment of problems. We can determine the reliable technique for the early detection of pregnancy. It would allow for the culling or rebreeding of barren or non-pregnant females. Pregnancy diagnosis is essential for reproductive management as well as economic production. It involves the production of meat and milk. Other than that, early identification of non-pregnant dairy cows and heifers post-breeding can improve reproductive efficiency and pregnancy rate by decreasing the interval between artificial insemination AI services and increasing the AI service rate. It will increase the production rate of the farm.